Carl was a 32-year-old man with a history of chronic schizophrenia. Carl had stopped taking his medications about 6 weeks prior to his admission to an inpatient facility. At that time, he had decompensated, was hearing voices, and was unable to care for himself. The occupational therapist was aware that upon resumption of his medications, Carl's thinking would clear and his symptoms would remit.
I have several concerns regarding Carl. Did he have any interests or experiences that would suggest a potential life role? How could he meaningfully fill his time and ultimately achieve an identity and satisfaction?
The therapist was aware that having a daily schedule and life roles around which to organize his time could help Carl stay internally organized and perhaps lessen his relapses.
How are you spending most of your days?
I spend a lot of time watching TV and going to the park and picking flowers.
As soon as he was able, Carl was invited to come to the occupational therapy setting and was asked to care for the plants there.
We want you to take care of the flowers here, Carl.
Carl immediately perked up, and the therapist used his interest in caring for the plants as a motivator for him to improve his self-care. It was agreed that a condition of his coming to OT was that he properly dress and groom himself, which he did. As Carl's thinking cleared, the occupational therapist used both the interest checklist and the role checklist to better determine Carl's interests.
I envision the role of hobbyist for Carl.
Sounds great.
I think we can set up a nice little garden football in the backyard.
Following discharge from the acute setting, Carl began as a patient at a day treatment center. The therapist informed the staff of Carl's interests and gave them suggestions on how Carl might use his skills at this setting. Carl was soon recognized as the official florist at the day treatment center.